Welcome to our podcast. In today's emission, we're going to be talking about mentorship. It's interesting to know that the mentor, came from, was adapted from the Greek mythology. When Odysseus, from the novel Homer, that Homer wrote, went to the Trojan War, his good friend, mentor, which Athena actually assumed the person of mentor, was to care for his son, Telemachus, while Odysseus was out. And so hence it was adapted as a wise, older person to guide and support the younger person. We have an awesome group of panelists, and I would like to have them introduce themselves to you.
I'm Linu Joseph. I am a family medicine physician. I'm core faculty for the Northeast Georgia Medical Center Family Medicine Residency. I also wear the title of Associate Director of Informatics.
Hi, I'm Radhika Prabhakar. I am an internal medicine physician, and I am core faculty with the Internal Medicine Outpatient Residency Program.
And my name is Dr. Matthew Janko. I am a cardiothoracic and vascular surgeon at Northeast Georgia Medical Center. I work with residents and students on my daily practice.
Welcome, everybody. Thank you for being here. So this is important for you to know that you are here because the residents actually picked you to be here as being great mentors. So, Matthew, let's start with you as to why do you think that the residents picked you? What qualities do you think you have that show up in the resident saying he's a good mentor?
There's always a risk with a cardiac surgeon to tempt there's a temptation to be egotistical. So I'm going to fight that urge, but also recognize the residents, and I appreciate that. So thank you for the question. I feel really honored and grateful to be sitting at this table with my esteemed colleagues here. And I'm really eager to learn from you all as well. I think the residents probably see me as a good mentor because I try to really care about their development. I, in the past, was a teacher, and I have been a coach and a sponsor, but mentoring is a little bit different from all those. And I think it comes down to caring about the individual. It's the same concept, I guess, as patient care, but a little different. And I hope that has come through in the way that I've interacted with the residents and students, and that's my best guess as to why I'm sitting here.
Thank you. Linu, same question for you.
I'm surprised, to be honest with you, to be sitting here with you, but I do think I take this job very seriously, like being a faculty for my residents. And I think it's more than teaching them about syphilis. It is also about helping them trust their own judgment. And I think I care enough to build them as a person. And so I'm hoping that's why I'm here.
Excellent. Radhika?
I think I definitely agree with what both Linu and Matt said. And to kind of build on that, the idea of caring about them as a person and not just sort of trainee number 6. I think I've been doing graduate medical education for a while, working with residents for a while, and I was a resident myself in the past. And I think we've seen a progression in the ethos of residency where we're trying to understand that residents are full people. They have emotions, they have feelings, they have needs, they sometimes have children, they have families. Trying to recognize and appreciate that they're not just necessarily sort of cogs in a machine, and accommodate that more. And so I think seeing that, remembering those things about them, maybe they have family abroad, maybe they have had some personal struggles that they bring up with you, and trying to follow up on that, making sure that they're feeling comfortable and safe and seen is really important.
Follow-up question for you. Has a mentee ever given you feedback that surprised you?
I think that one thing that surprises me sometimes, well, number one, I was also like Linu, I'm sort of surprised to be asked to be here. I wasn't expecting that. But I think sometimes the people who come to me and ask for guidance and mentorship are people, it's actually interestingly, it's residents I usually admire, and they seem very confident and they seem like they really have everything together. But then occasionally they'll come to me and they'll be like, what should I do here? Or what's the best next step? And I'm like, oh, I would think that you would already know that. You seem like such a well-rounded, well put together person. So that sort of surprises me sometimes, the residents that still seek out feedback.
Linu or Matt, any surprising feedback you've received from your mentees?
It's a good question. The most I don't know if it's surprising feedback, but it's feedback that I recently got from one of my mentees that made me like reevaluate the way that we think about each other very deeply and where we came from, which kind of comes back to how we started the podcast. So the residency concept and, the term that we use sometimes on rounds is like pimping and like dehumanization and like these concepts that Radhika was bringing up. And that's kind of like a core value of how this whole house was built. It's like the foundation of everything that we know in the past, the recent past, not the distant past. But as it pertains to residency training, it was a grueling, dehumanizing process. And now we are kind of turning a corner a little bit, I think, as a society and as a specialty for medical training and surgical training. And the feedback that I got from one of my mentees, who's a very mature, thoughtful, introspective resident, was to try to eliminate or limit public shaming and humiliation. Mm-hmm. But that is actually a core value and foundational aspect of, rounding and pimping and all these things that we kind of were trained with and on historically for like 100 years. So it's an important question. I'm really curious to kind of hear what you all think about that concept, because there is a huge amount of value in this extremely negative way to train people. But as we all have seen in the past, I think sometimes the result isn't ideal.
Good, great points. Linu?
I was going to say that one of the things that surprised me when I first started was similar to what you were saying, that I had a mentee come tell me, I feel like I'm disappointing you when I bring up my struggles. Mm. So I changed my mentoring a little bit because I want them to see me vulnerable too. So I felt like that was the feedback that I got. I felt like as a family physician, I should show them that we don't have all the answers. And sometimes, so I'm a little bit more verbal about my vulnerabilities these days. It's like, I do not know how to treat syphilis. So I do know, but do you know what I mean? Like I do go look that up together or kind of help them learn together.
How much syphilis is going on here? This is a problem.
But so I do use my mentoring as an opportunity to show them that it is okay to be vulnerable and not know all the answers. And it's about asking the right questions. So
let me double click on what you said. And obviously, it sounds like you've adapted your style of mentorship or evolved. Yeah. Besides what you've learned from your mentees, do you have a mentor from your experience that, is a present, always like guiding you?
Yeah, I do. I mean, I've been lucky with many mentors in my life, some longitudinally throughout the years, some just occasionally give me advice, or I just need somebody to bounce off some ideas and stuff like that. And you're one of them, Dr. Rios. I don't know if you realized that about 2 years ago, I asked you about my career and you had mentioned informatics. At that time, it was way off of what I was doing. But I did explore it a little bit, and now I'm the associate director of informatics.
She's one of our informaticists.
Yeah, so I think it has opened up. So I think, I've been blessed with them. And Dr. Monica Newton, you probably all know her, and she was assigned to me as a mentor when I first joined NGPG 10 years ago. They had a mentorship program. I don't know if they still have it. So our relationship started then, and she knew my interest in teaching, and she's all about pushing me to get to my full potential. She would say, hey, what about this fellowship? Or what about this? And so it was, I had read somewhere, to be your mentor, I need to be your tormentor, somebody that pushes you out of your comfort zone. And she was definitely that for me. And I have a lot more, but I'll let you talk about yours. But
Radhika?
I've had several as well. I've been very lucky as well. And the one that comes to mind for me is actually, so I struggled a lot in residency, particularly with cardiology. Sorry. It never came to me. It wasn't intuitive to me. And I remember being on the CCU rotation and just having a really, really hard time because it felt like everything was so high level. And I was like, what can I even contribute to this team when they're talking about like this procedure and that procedure? Like, and I'm just talking about how much Lasix the patient got. Like, I felt like I was just sort of, ancillary to the whole process. And one of the attendings who I was so scared of because she was like so hard in a lot of ways and so strict, she sat me down. She was like, I can see that you're struggling. What do you think is going on? And so we kind of talked about it. And then she said this one phrase that has really stuck with me this whole time. She said, don't think of them as cardiac patients. Think of them as internal medicine patients with cardiology problems, and they need your help. And so that phrase, like, they are patients who need your help, has really stuck with me, even, through all the difficult situations, times where, you feel overwhelmed or you feel burned out. That's been sort of a North Star for me. And I think it was interesting because she wasn't one of those people I would intuitively turn towards. She was somebody that was, again, kind of intimidating.
Was she a cardiac surgeon?
No, but she was a cardiologist. But yeah, the fact that she had such words of wisdom and she was able to come down and see things from my level and understand where I was coming from was something that's stuck with me till today. And it's something I hope I can do.
Did that help to change or modify your mentorship style?
I think so. I think the main way now that I try to put that into practice, beyond just telling residents who, again, are feeling stressed or overwhelmed or like they're at their wit's end or that they have too much to do, I try to remind them of the human factor and that this is a person and that, there's a lot you can do for them to make their life better in a significant way. But also trying to keep in mind what a lot of our residents are interested in fellowship. So trying to keep that in mind when discussing a patient with them and trying to make it relevant to whatever their career interests are. Mine was general internal medicine. So she was like, think of this as a general internal medicine patient with some cardiology issues. So, if they want to go into cardiology, then sort of talking to them about the patient's cardiac history, focusing on that stuff from a primary care perspective.
Thank you. Great. Matt, how about you? Mentors in your life?
Yeah, I think I would just echo what everyone has said already. I feel incredibly lucky to have been identified and to have identified, with mentors in the past. The mentor that got me into cardiac surgery and inspired me to do cardiac surgery is a guy named Alan Markowitz and was a cardiac surgeon in Cleveland for a long time. And just retired last year at the age of 80. So, and I met him when he was 70, whatever, 5 or something like that. And so you can imagine the drive in that guy. And
because you were a vascular surgeon prior to.
Correct. Yeah. And I was, on a board certification track for vascular surgery as a resident. And then I rotated through the cardiac OR and I was like, this is really beautiful. And the reason why I came to that conclusion at that stage was because I had matured in my own and had my own mentors in vascular surgery, but also because of one of my mentors, who I mentioned, Dr. Markowitz, kind of just allowed me to see this room, open the door, and gave, like, the key was just given to me, and his descriptions and in a way, I guess, his vulnerability kind of came through, and he was just an open book and everything just flowed from him. And I just thought it was awesome. So I really appreciated that. And then, I've had several mentors through the years. But most recently, we were just talking off camera a moment ago about my senior partner, Dr. Clifton Hastings, who I'm sure you all know, is a mentor to me every day and recently, helped me in the operating room just this week. So he continues to be a really positive force for all of us, really, and for me especially, I think, being the most junior partner in the group and just looking after me and trying to be the model, if you will, like who you want to grow up to be.
That's a great answer, and I agree. Dr. Hastings is the guy that we should aim to be like. As we grow and evolve, we learn, and many times we learn from our mistakes. So what is something that you guys would say, this is what I did before, but like, oh my goodness, I can't believe I did that, or I've tried to avoid doing this when I'm with mentoring a person?
So I think for me, in the beginning, it was more directive. I felt like I need to have all the answers, and here, you need to do this to be able to do what you need to do. So it's more directive. But now, over the years, I have changed into more collaborative. Okay, what is that you are thinking? And I think that goes with my teaching too, like not just mentoring. I was more directive, and now I feel like I'm more collaborative on what mentoring is and what they want. I think I was being a helpful supervisor kind of thing, but not really thinking past that moment. Okay, I can fix this for them, but I need to be able to kind of help them see how to trust their own judgment and all of that. So I think that has changed for me over the years. And I think I'm becoming a better listener as the years go by. I can pick up on clues. It is hard because I need to just say something. Can I just say something and just fix this for you? So I think it's a mutual journey for both. I think the more people I mentor, I have changed as a person. But the one thing I haven't changed is that I make almost everybody read Who Moved My Cheese. Because that is important to me. I think that's what mentoring is about, is moving your cheese. So you just get
Could you explain that a little bit?
So have you read that book?
I don't
It's
know,
a book called Who Moved My Cheese. It's about two rats and two people stuck in a maze, and they used to go to the same place, eat the cheese, come back, be happy. But one day somebody moved the cheese. So like one of the rats stayed back, the other one went looking for it. So it's the concept of being outside your comfort zone. And I feel like medicine, we are so focused on treatment and all. There's so much we could do. Like Dr. Rios is doing population health. It's beyond one patient. So to my mentees, I think that's what's important for me to show them. If they choose me as their mentee or mentor, I try to open that for them and say, hey, what about health policy, advocacy? Pay attention to what's happening around you. So I think I have evolved from a mentor who tells you to do sports medicine elective to be able to apply for a sports medicine fellowship. Beyond that, have you noticed what's happening in the sports medicine world? And, what about equality and all of those things? So I think I have evolved to kind of help bring those things up more comfortably than I had in the past.
This is reminding me of an excellent mentor, a female vascular surgeon at Johns Hopkins who recently retired, and she would have like like if you wanted her to be your mentor and your sponsor, which was a powerful thing for people, you had to like come prepared and read the books and have a plan and that sort of thing. So it sounds like, is that you?
I'm not that intense.
She's kind of an amazing, intense
but
person.
I do. I have never been formally trained in mentoring. It's a lot of trial and a lot of error. So I've done things
experience.
where
that's
experience, right?
Yeah.
So I have done things where so we in our residency assign advisors. So I have like 4 or 5 advisees, which my job is to make sure they meet all the graduation criteria, like they do their QI, they meet their numbers and graduate. But those are not really mentoring. But I have some residents outside of that structure comes to me and say, hey, I'm interested in this. What are your experiences and stuff like that? So
what's your mentoring structure for your trainees?
So we only have advisees per se right now, like formally. Informally, like I have a few that comes to me because we have similar interest in quality improvement and all of those things. But we don't have a formal structure for mentorship. But right now we have like a third year, a second year, a first year that are assigned to us, and we just help them get through residency. but it's not truly a mentoring experience.
Kind of like loose and unstructured, ad hoc.
I'm saying, hey, make sure they
meetings
like on board with their passing their steps and all of those things.
Radhika, in the internal medicine program, there's a little bit of a structure for mentorship.
Yeah, I guess you and I both have some mentees, and the way it works is it's a little bit more formal, I think, than what Linu is describing. We do kind of have a checklist of requirements that they're expected to meet, and then we also go through their evaluations. If something comes up in between our meetings, usually the program director lets us know, and we also will sit down with them and talk to them. And we also talk about career goals and things like that. And I think we also usually try to see where they are emotionally, how they're doing, how they're feeling about the program, how they're feeling about themselves, how comfortable, confident they are, those sort of touchy-feely things as well. I think we try to integrate that into our session.
Do you have like a formal set of questions you use for that, or no?
We do have like a checklist that we kind of go through.
For both the like administrative, but also the emotional side, or just for one or the other?
Just for the administrative. The emotional, I think, is more just conversational.
Right, and I think if there have been any concern cards or any comments that any feedback that has been given to the resident that is not quite positive, to dive and dig deeper into that.
Yeah.
And you're getting that information from the resident.
And their evaluations.
Oh, you get their evaluations too.
Right.
Because I don't, and I'm trying to figure out the best way to navigate all this, and it seems like it's a good structure.
Yes, and I think we need to get you on MedHub, but I think that really sets the stage for, as some of us more than others have been here for a while and have noticed that different generations that come up. And, you have mentees where you struggle to connect, and I think that is crucial to be able to have a mentorship relationship, that connectivity, which could be because of cultural, generational barriers, language at times. So when you've had, Radhika, let's start with you, a resident that, can't really connect with this person, and you know that they're struggling and you can't, what has been your style to try to overcome those challenges and be able to have a connection at least with that person?
So I think I'm lucky in being a primary care physician because I've already had so many experiences like that with patients, where like you just meet a patient and the energy is just off, or maybe it's not just the energy, maybe they say something or do something that just doesn't seem to really vibe well with you. And then, like you're still responsible for that patient and they still see you as their primary doctor. So, over time you just meet with them again and again, and eventually you kind of break through and you're like, no, you really do need to take a blood pressure medication. Like, this is our 5th meeting about this 180 over 110, and you get them to take the losartan. And so I think it's similar with residents, or at least analogous. There are some where, again, like you just might not have much in common. You might come from very different backgrounds or see things very differently, or again, just that energy might be off. But I think having the persistence to dig through that and sit with that discomfort a little bit and work through it. And again, a lot of it is just kind of putting in the time and talking to them over and over. You might be able to, or at least I have found that you can kind of break down some of those barriers and both of you can expose sort of your real selves. I mean, it's not easy, and none of us are formally trained in like psychology or psychiatry or those, or I assume none of us are, those tools. So I guess it's just doing it through experience, but that just patience and persistence and listening more than you talk and trying to understand have been the tools that I've used for those situations.
Matt, have you encountered something like this?
I think it's a really excellent question, and I can't help but notice that the nominees or whatever we are up here I think we're all quite young. And
mine was the moderator.
And I think, you've already been identified as a great mentor to this, generation of folks at this table. So it's actually a really interesting kind of point that you've brought up. I think there is certainly an attenuation of some of the original expectations and the way that medical training and surgical training began over the years, and that may not be all bad or all good. And as we kind of mentioned earlier, it's just a question of, well, what are we all willing to accept and what are we all willing to kind of discard as time passes? So, it's tough for me to, I'm sure in the generations before me, those surgeons looked at me, they're like, this guy's so lazy. He doesn't even stay every night in the hospital, and
he goes home sometimes.
He goes home and has a family. I mean, I have mentors who weren't allowed to have a spouse when they were in training.
Oh, wow.
Yeah. So, and at very well-known programs. It's just a sign of the times that we're treated like humans and we're sensitive to these things and we're talking about emotions and having this conversation to begin with, that this would even be a thing, which I think is a good thing. So I'm trying.
Excellent answer. Linu?
I think what I do not do is, back in my day, I never used that term.
That is
Try
very
not to
tempting
use
to
that
say a lot.
as well. The other thing is I try to find a common shared purpose, Like when I have a mentee, their purpose is to be a good physician, and I can share that, that's what their purpose is. So I try to stick with just that. Like, there's so many things around them that I cannot change, or they don't want to change, or they don't want to talk about, but I know that one shared purpose. So I try to find that one shared purpose that I can with them. How can I be helpful? What can I do for you? Because you know what I mean? So I try to find that. I think that has helped me the most and even with patients, like finding that common purpose of, okay, you want to be healthy, how do I get you there, kind of thing. So
is there something that you look for to say, okay, this is working, or, oh my goodness, these are the signs that this is not going well?
I just ask, is this helpful? Hopefully they'll be honest with me and tell me it's not working. But if they don't make a follow-up to follow with me, maybe it's not working. But I don't hold them to my advice. Do you know what I mean? Like, right. If we come up with a plan and they don't follow through with that, I don't take that as it's not helpful. Mm-hmm. I just ask them again and say, okay, so that didn't work out. What else can we do? Mm-hmm. So just plain old ask them, I guess, is it helpful?
Radhika, anything you look for to see whether things are going well or not?
A lot of mine, and again, I think it's based on my patient care experience, is based on reading body language and like facial expressions, because there is, as much as we're talking about like how times have changed and how, it's a softer, kinder training world, there's still a little bit of a power dynamic. And so I feel like a lot of times they'll tell you one thing, but their body is saying something else. And so, I'm very comfortable just saying like, is this okay with you? Or sort of like what Linu was saying, like, is this helpful? I feel like maybe you're telling me something, or I feel like you seem uncomfortable with this. What are you thinking? What's going on? Which sometimes works, sometimes it doesn't. But that's my tool that I use, I guess.
I think many of us are, not naturally comfortable at having crucial conversations with peers, residents, nursing staff, administrators, but sometimes they need to happen. And Matt, any of those difficult conversations with resident mentee where that these person are on a path where they're not going to be successful, and that's everybody knows it except that person, and you try to tell that person, and they're alone against the world. It's everybody against me. I'm the victim. Any experience with those scenarios?
Yeah, those are tough. Yeah. You have some mentees that are just A+ across the board, platinum, no problems, and then you've got some mentees that really need a lot of help at times. So a couple of things that I've done that I think have worked for me. The first is that whenever I have a formal or informal or as frequently as I can meeting, I try to have someone from our staff who's a professional, in my opinion, such as Megan, who's here with us behind the camera today, to observe and be helpful and give me feedback after the meeting is concluded with the mentee. And that allows me the opportunity to debrief, get some structure, get some feedback from someone who has experience. And for me, that has been very helpful for the next round when I set up the meeting with that person that's having a problem. If the mentee is, full bore, no problems, then okay, we'll figure it out, whatever comes up in the future. But for those mentees that are having active problems, and sometimes they can be quite dramatic, we schedule a close follow-up and review the points to either go over closely or completely avoid with the next meeting, which has happened. The other thing that I like to do is, as I mentioned, the bringing in other people extends to after that meeting. So, for example, I can't really relate to everybody with everything, but I usually know somebody that can relate to that problem that the mentee is having. So I'll say, hey, Antonio, would you be interested to talk to, for example, one of the plastic surgeons who has this problem and really navigated it beautifully and found a good work-life balance and that sort of thing. Those are a couple of the strategies that I've used that I think have been helpful.
Excellent. Any other comments?
I do think that when resident is struggling, I like to assume positive intent because I don't think anybody wakes up in the morning to do the worst job ever. You know what I mean? So I think when they do that, I try to get and see why. Is it the ability problem? Like they don't know how to do it. And I'm surprised how often that come up. Like they just don't know how to talk to somebody or... So I think getting to the root cause of the issue has helped me a couple of times because they're thinking they're being biased against or something is happening that's making them do those things. So I always go down and see if I can find the root cause of the issue.
Very good. So moving on, I think some of this conversation you guys already touched on, but has there... one of you already said what the statement you did, Radhika, about the mentor shared with you that stuck with you. That was a great piece of advice that you still carry on to this day. Is there a similar example for you, Linu?
Of what my mentors... I mean, one thing that they helped me realize is that I have agency. And I think I often forget that I'm in positions...
Can you explain what
so
you mean by
agency is that I have the capacity to make my own decisions and voice my own opinions and look into myself and see. So I think aside from medicine and all of these mentors throughout the years has helped me realize that I have voice and agency. So I think I carry that and I try to tell that to my residents as well.
And Matt?
I think that
Or
the...
Go ahead.
Oh, sorry.
Go ahead.
Well, one piece of, I think, clinical advice that it's not a great example, but something that I try to keep as a guiding principle is if you can't do it, then it can't be done. But that doesn't mean that I, as the individual, can't do it. I take that advice that I got from one of my mentors to mean if we can't do it, it can't be done. So I always like my last response, and I think it's kind of an extension of what Linu was saying, and I think, which is to say that like I will do everything I can, I will say everything I can, I will reach out to whoever I can to have a successful goal that we've identified, which is I think one of the themes that we've all said in a way, that we want to have a successful outcome, we want to have a successful relationship, we want to have a successful mentee, whatever that means to them, and we will do it. Like, it will be done because we are committed to that.
Very good. So I think that we all agree that mentorship is super important and probably nowadays more important than it used to be. any ideas on how to make it stick? How to make this a part where everybody takes it for granted that, oh, okay, yes, of course, we're having a mentor. In the GME Family Medicine program, we're talking about NGPG, used to have that program, lost it. Mm-hmm. How can we get our leaders to think about establishing this program, of course, for our residents, but also for ourselves, as when we come in and we have, learning the culture of the new group, navigating a health system that is new, the electronic health record, and so on and so forth.
I mean, I do think it needs to be a priority because teaching medicine, because I've been doing this for a little bit of time, is different. They can always look up on open evidence how to treat a patient, and they can figure it out. So I do think that they struggle with the other part of handling medicine, and that can only come from an experienced mentor kind of teaching them the ropes per se. So I do think as a system, we should prioritize having mentors and publicly recognizing it as a mentorship program. And also leadership has to model it down. So I would love to spend a day with you and see how you do things. And so those kind of formal avenues needs to be available, not just for the residents, but like you said, all family physicians. Because even 10 years into practicing medicine, I still look for mentors
of course,
to kind of help me practice and live medicine. So,
Radhika?
I think the beauty and maybe also the curse of medical training up until you become an attending is that it's very structured and there's very clear rules and things that you do to advance to the next step. Study, like for the first, 15, 20 years, it's just do well on multiple choice tests for the most part. And then do relatively well in your rotations. And then it's get into residency and complete all this checklist of specific requirements, and then get into fellowship and complete this other checklist of specific requirements and continue to do well on multiple choice tests, all of which is a lot, but it's pretty well defined. And then suddenly you're attending and there's nothing, you're just kind of thrown out there, and you have to think about, well, what is my, so far my 5, 10, 15-year plan have been sort of defined for me. Going forward, I have to define that for myself. And how do I do that? And it's very challenging. Do I just want to be a clinician? Do I want to wear other hats? Do I want to exit the clinical world altogether? And so I think if there is a way to imbue health systems with that same, I know it can't be quite as concrete as medical training, but a little bit more here are steps you can take, here's a ladder you can climb, here are at least some things you can do, a little bit more structure for the different types of career paths, or a little bit more education about the different types of career paths to help people move forward. And then a lot of times, like Linu was saying, you have to develop these soft skills of negotiation, discussion, having to work with people that you might have conflict with, maybe some training or programs around how to do that, because people might not have had a lot of medical residents. They're 26 at the youngest when they start their first real job. So they might be a little bit behind in some of that stuff.
Yeah, I mean, for you guys, the surgery, all of a sudden, that's it. You're the guy in charge.
Yeah. It's great. No. No, we have the gift and the curse of a longer training path, which comes with its own battle scars. But we, I don't know how to phrase it, but whatever it is, steel hardened steel, and you come through this fire hardened up, and whether that's good or bad, I'm not sure. Probably could be a little better, but could be worse too. But I think to your question, I agree with everything that's been said. And it makes me think of one of my formal mentors who was assigned to me by the STS. I'm so lucky in my training. My mentor in Cleveland is the current Society for Thoracic Surgeons president, Dr. Sabik. And the STS is one of our large national and international societies that we're a part of as cardiothoracic surgeons. And they have a mentorship program where I was assigned a great guy by the name of Steve Gurnt, who's a practicing cardiothoracic surgeon in Wisconsin. I've never met him in person, but I would love to, because I really agree with what you said earlier about that, non-verbal communication that we all benefit from. But even just the pure verbal communication I've had with Dr. Gurn has been like so great for me. And what he does is he takes this mentorship question that you've asked very seriously, and he has a I guess it's a program called Civilitas, and I would encourage everyone to look into it, and it would be, I think, very helpful to our program of trainees and our institution to align with the values of Dr. Gurn's program. And if we could have him here as a speaker or something to give us that inspiration, I think that would go a long way, because there is so much to learn that we just simply do not get in our medical and surgical training, and I think that's very important.
Thank you. And Matt, following with you, we're around a lot of people, a lot of colleagues, and you say, this guy's a natural at mentoring, how do you reach, and they're not doing it officially. What would you say to that person to say, hey, we should grab you, or we should, put you as one of the official mentors, or give you an official role for this?
Well, I think I don't know how to go about doing it, but we just need to change the value priority hierarchy of mentoring and teaching. Is basically a societal problem in this country, probably. And I was a teacher for a short period of time. My sister was a teacher. My father was a teacher. Like, it's just not a highly valued profession for a number of reasons, but I don't think that that's right. And I think that we should try to, like you said, kind of recognize those folks and put the people who are good mentors or teachers or whatever value we're trying to idolize up on, in a spotlight. And this is a great example of that, I think. So I just wanted to thank you and thank everybody in the education group for doing that.
Yeah.
Radhika, any advice for colleagues that you say, these are good? Obviously, you're around core faculty, but for the non-core faculty that you see or run into?
I do think that it takes a certain person to succeed. And I think a lot of that depends on how willing and interested they are in it. So I think one useful thing is to just sort of suss out if it's something they have an organic interest in. And if they seem like somebody who's very busy or somebody who just, it's not their forte, I don't know that like foisting a trainee upon that person would necessarily yield the best results. So I mean,
shield them.
Yeah. Yeah. I wouldn't necessarily,
it goes both ways. Yeah. That's a good point.
Yeah, exactly. So I think, because the reason I bring this up is because my initial thought is, well, maybe we should just ask our trainees to approach people who we think would be good mentors. And I think that's reasonable, but I think they should also, if we do encourage them to go about it that way, to go from the trainee standpoint, we should also let them know that not everybody is interested and they might not be some of the people they approach might not be super receptive. So I think maybe if we can do a little...
Sounds familiar.
Run a little interference first on our end and just make sure it's something they're open to. I think most people are, but some people are very busy. So,
Linu, any advice to the mentees, to the new people coming? We had this room was full last night.
For white coats.
Brand new residents.
For them, it's going to take a minute to identify a good mentor.
Yeah.
So I think my advice is more for the ones who've been here for a year or so, because I do that. I approach people and say, hey, do you have like 5 minutes to talk about something? Or can I get on your schedule to talk about something? And I actively pursue some of my mentors. And then I talk to them and I was like, no, we're not on the same page, and say thank you for your time and move on. So that's what I would tell them, like keep your mind open and kind of see what's out there and what interests you. And networking, talking to a lot of people, and that's how you find what you're interested in. Like I didn't even know about informatics until I started really thinking about it. So I think that's the key. And being flexible and adaptable to whatever comes your way. That's what I would tell them.
Any parting words?
I would say, number one, sorry, I have maybe more than one.
How many words are we talking about here?
My 500-word concluding essay lined up. So I think listening more than you talk is an important skill to cultivate, and one that I'm still working on. And then I think as everyone has mentioned, but I think Linu especially highlighted, being humble, being willing to apologize if you feel like maybe you did make a mistake, or at least have an open conversation about if an interaction went a way you didn't expect it to. And then, as she also said, just being vulnerable. I think that can be very meaningful as well. Just being willing to expose your own fears, your own struggles, particularly when you were at their point in training. And just remembering, just like with patients, remembering the little anecdotes and things they tell you. I think bringing that up again can show that you really do care about them and you really do listen.
Matt?
I really enjoyed this conversation, and it was a real pleasure to meet you all. I don't have any great parting words, but as long as we're talking about book suggestions, I'm going to read that book. Who Moved My Cheese? I'm going to read that book.
Yes.
I think that if everybody read the book How to Win Friends and Influence People by Dale Carnegie, the world would probably be like a way better place.
Yeah.
And the mentoring interactions that we have might also be a little bit easier. So I'll put that out there.
I think you all touched on anything that we can think of what a mentor should be. Give direction, tell the truth. That you can sugarcoat it a little bit, but at the end of the day, the mentee needs to listen and hear the absolute truth, and give them the courage to push them to take action, make ourselves vulnerable. And like you said, you give advice. It's not a directive, and that they chose something different. That's okay. That's it's up to them to build the path that they choose.